Welcome, everyone. Thanks for joining us for the October 2017 CDA vendor webinar. We will be presenting information primarily related to the upcoming 8.8 release and general NHSN updates. I am Mindy Durrant and will be presenting along with my colleagues Casey Thompson, Wendy Wise, Ahmed Tahir, and Amy Webb. The webinar will be posted on the NHSN CDA submission support portal soon. We have a lot to cover today, so Ahmed, please start us off.
Right. Hi, everyone. Thank you for joining the webinar. I'm going to quickly go over some highlights for upcoming changes and updates in NHSN, and then also quickly we're going to be going over new changes for the dialysis component. Starting with some brief announcement about our release schedule, we are going to continue one major release a year, as in the years past. Our efforts will be to have this release go live around January 1st, 2018, and this will include all of the NHSN surveillance protocol changes that go into effect with the new calendar year, and also to transition to the new CDA versions that are due in part to the protocol changes themselves. In addition, 3 scheduled non-major releases a year that may include minor defects resolutions, minor change requests, and infrastructure maintenance and support. If you go to the next slide. All right. For our 8.8 release, we have it currently scheduled for December 2nd, 2017, with an effective date of January 1st, 2018. We have moved from the deployment a week ahead of schedule, and this will allow more time for testing. Defects will be effective immediately post-deployment, and CRs will be effective from January 1st, 2018. Next slide. NHSN will also now provide a defect list on our webpage. Right now, a list of our 8.8 release is scheduled to be posted in late November, so please keep an eye out for that, and we will be updating this list every couple of weeks. Next slide. In addition, the NHSN program will also be shifting to a new help desk system. You will continue to use the same email addresses for any issues. So any issues related to the CDA mailbox will still go to NHSN CDA at cdc.gov. And then general questions and inquiries about protocols and A&R will go to NHSN at cdc.gov. This new system is based on a ticket number, which will allow better tracking for us as well. And the system is tentatively scheduled for 2017 or early 2018. All right, next slide, please. So I'm going to be starting off with the dialysis component. If you can go to the next slide. So we're going to start off with CR 1581. This CR is going to be implementing a new CDA dialysis numerator using the R3D11IG. Currently for 2017, we are using the R3D1IG. The new IG, the R3D11, will be implemented in January 2018, requiring dialysis events dated 2018 and beyond to use the R3D11IG. If you go to the next slide, please. There's an additional question added to this dialysis numerator CDA. If new antimicrobial start equals yes, then was a blood sample collected for the culture? This question will now be required, and if you look for it on the mocked up form, the code is 2339-0. This will begin from January 2018. You can also refer to the toolkit that has been posted on the website, and from the toolkit you will be able to find the R3D11IG, the 8.8 IDM, XML samples, and mocked up form for this dialysis form. Next slide, please. On this slide, we can see we have the timeline for our 8.8 IG. So any events for dialysis dated 2017 and prior must use the R3D1 version of the IG, and anything with dates of 2018 and beyond must use the R3D11 version of the IG. Next slide, please. All right. So an update for the CR 1837. Initially, the CR was updated from a previous request regarding the AKI patients. This will no longer be on the dialysis event form. AKI will now be added as a location for patients in outpatient hemodialysis centers and will be reported as a location in dialysis events and summary data. The next slide here shows a sample of a CDA sample with the AKI location. So here you can see on the XML CDA sample, we have the highlighted area where AKI has been added as the location. All right, and I will now turn over to Casey Thompson.
Thanks, Ahmed. Hello, everyone. My name is Casey Thompson, and I'm going to discuss the Antimicrobial Use and Resistance Module 8.8 updates. Next slide, please. First up, let's discuss the AU updates. Change request 1789 is adding a new drug to the AU option, delafloxacin. This additional drug will be optional for data reported prior to 2019, and the drug may be added for any year. It will be in the same format as other AU drugs and will be in the new version of the IDM. Next slide, please. Change request 1733 is adding one new bar chart to the AU option. It has no CDA impact. This new bar chart, as you can see on the slide, will show selected agent distribution by location and month, so facilities will be able to see more granular data in the bar chart. Next slide, please. Defect 4524 also has no CDA impact. The AU bar charts are intermittently not rendering, so when running a simple bar chart report for AU, there are specific locations that show up as an error icon, as you can see toward the bottom of this screenshot, and this will be fixed in the new release. Next slide, please. Defect 4739 involves an incorrect error message when there are not enough drugs in the AU summary CDA file. So as you can see on the left, the current error message says less than 4 observations reported. And the new corrected error message on the right will say an error has occurred. The number antimicrobial agents expected is to be 89 or 90. And the reason for the new range of 89 or 90 is due to the new drug, delafloxacin, we discussed earlier. Next slide, please. Now this next change affects AU and AR, but it has no CDA impact. We added 2 new variables, AUR Farm and AUR Micro, to the Advanced Monthly Reporting Plan line list. They'll be in the same order as the NHSN Monthly Reporting Plan. Next slide, please. Okay, now on to the AR changes. Change request 1816, we added 6 new pathogens for the AR option with these 6 new ESBL-specific SNOMED codes, like you can see here on the slide. So all 6 of these will roll up to the pathogen without the susceptibility description, but you will be able to use these specific ESBL SNOMED codes with the 8.8 release for your AR option data. Next slide, please. Change request 1790 is removing missing summary data alerts for outpatient locations submitting AR events. Has no CDA impact. As you know, the application does not allow AR summary data to be submitted from any location other than FAC-wide-in. However, the application is triggering a missing summary data alert despite facilities being unable and not required to submit the data. It'll be fixed in the new release, and the alerts will be automatically cleared for facilities. Next slide, please. Change request 1735 has no CDA impact. We rearranged the variables to the default AR option line list to make them more useful and user-friendly. Next slide, please. And then we have 1 AR defect slated to be fixed in the 8.8 release. Defect 4499, AR event null flavor fields are displaying as E instead of not tested. So basically, when the null flavor fields are used for the specific test results, meaning the E-test, the MIC, or the KB Kirby-Bauer test in the CDA file, when that very first drug in the CDA file is listed as not tested or NA, then that is showing up as E, just the letter E in the database and in the analysis reports instead of showing up as not tested. Not only seems to affect the data when the very first drug in the CDA file is listed as NA or not tested, and thankfully it does not affect the final interpretation, just those specific test results. Next slide, please. So on this next slide, I have a screenshot of what it would look like if you were to run the AR event line list. You can see here highlighted in yellow for this event, it's a Candida auris AR event. The very first drug in my CDA file, anidulafungin, I have NA or not tested for my e-test in the CDA file, and it imported just fine. However, when it's saved in the database, it's saved as an E instead of N or not tested. Okay, that's all the updates I have. Next, I'm going to turn it over to Wendy Wise to discuss general AUR module updates. Wendy?
Thank you, Casey. On these next slides, I'm going to share a few general updates related to antimicrobial use and antimicrobial resistance module in NHSN, including use of NHSN AUR module for meaningful use stage 3, new resources, and a quick update on the synthetic dataset project. Next slide, please. As of Monday, October 9th, 84 facilities have registered their intent to submit AU and AR option data into NHSN as part of Meaningful Use Stage 3. As a reminder, reporting AU and AR option data into NHSN is just one of the ways your facilities may satisfy the Meaningful Use 3 public health reporting requirement, but it's not the only way. To verify if your EHR systems and modules are certified for the Medicare and Medicaid EHR incentive programs, you can search using the Certified Health IT Product List, or CHPL, link provided that's on this slide. Also included is the URL for an overview of CHPL. Next slide, please. A new resource has been posted to the NHSN website since the last vendor CDA webinar back in May. A Quick Learn series video demonstrating how to upload CDA files into NHSN was posted this past August. The video is about 12 minutes long. It's a relatively short video, and it's a great resource for you as vendors, as your facilities may reach out to you for guidance on troubleshooting uploading CDA files. Very soon, another Quick Learn series video will be posted that demonstrates how to run and interpret a standardized antimicrobial administration ratio, or SAR. Next slide, please. The Society of Infectious Diseases Pharmacists, or SIDP, that you may have already heard of, their website contains a list of software vendors that have self-reported successfully submitting data into the NHSN AU option. The URL is listed on this slide. It is recommended that you keep the information on this website updated. If you're not on the list and you have successfully submitted AU or AR data, you're encouraged to contact SIDP to be placed on the list. CDC NHSN team often refers to this website to view vendors that have successfully submitted AU or AR data into NHSN. Next slide, please. The AU Synthetic Dataset Pilot Project launched earlier this year. The purpose of this project is to use synthetic data to ensure that vendor ADT data and medication administration data are aggregated correctly, according to the NHSN AUR module AU option protocol. This project is not intended for testing or validation of CDA files, however. 2 vendors have successfully validated the AU synthetic data by loading the test data set into their database and processing it just as they would their own real data, generating monthly summary data for the facility-wide inpatient and eligible locations. We're actually in the process of creating an additional AU synthetic data set that includes antimicrobials and routes of administration that are not in the AUR module protocol. Additionally, in 2018, we anticipate creating an antimicrobial resistance synthetic data set for vendors to validate. If you'd like to obtain more information or to even participate, you can feel free to contact me at the email listed, wwise@cdc.gov. We also have a 20-minute video that demonstrates uploading synthetic data set into an example vendor database and then submitting the AU output summary file to the web application for validation. You might find this useful. Okay, next up is Mindy Durrance, and she's going to discuss the patient safety component.
Next slide. So the next series of slides are a review of the 8.8 patient safety component changes. Some will be a review of the material presented at the May CDA webinar, and some will be new material. There's one CDA-related defect pertaining to a Lab ID CDA that had a misleading error message. It read, date admitted to location must be greater than or equal to date of birth, instead of greater than or equal to date admitted to facility. Next slide. CR 1663 pertains to the MDRO summary. The C. difficile test method will be required for 2 inpatient rehab locations if the CMS IRF equals yes. The location codes are rehab and rehab pediatrics. The CDA test type is expected to match the FACWIDE-N MDRO summary. For CDA import, if the CDI test method does not match the summary, the CDA will still import. The MDRO summary will be listed on a new alerts tab called Confirm CDA Test Type. The user will need to log in the application to verify. Next slide. CR 1715, and actually the next 2 CRs are for SSI and GI event types. As you know, SSIs are valid CDA imports, but GI events are not a valid CDA import. The SSI criteria definitions have been updated in the protocol and include 2 new specific criteria. They are hypotension and elevated transaminase levels. These are both considered as other signs and symptoms. The IDM did not need to be updated because other signs and symptoms is already included for 3A and 3B. Be sure to refer to the IDM specific criteria VR tab for the details. Next slide. CR 1760 is also for SSI events. There is an update for the GIT specific criteria definition 1B. The screenshot shows the information in the IDM specific criteria BR tab. Next slide. CR 1722, there will be another ICD-10 CPT code update for the January 2018 release. We are still waiting on the codes to be delivered to us. We will add them to the IDM and distribute to you as soon as possible. Since this slide was made, we have heard there may be a delay. If they are not ready for 8.8, then they will be referred and released in the January release. Next slide. The next 3 CRs, 1688, 1785, and 1816, are all, we'll talk about as a whole, and then we'll talk about each of them separately. The new pathogen list will be versioned. This is the first time the pathogen list will be versioned, and NHSN plans to continue versioning the pathogens each year. Event dates greater than or equal to 2018 must use the 8.8 IDM pathogen code 2018 list and the business rules. Event dates less than or equal to 2017 must use the existing pathogen code tab in the current IDM. If an event is edited, the rule will still apply. For example, If a BSI where the 2017 event date is edited, it will still use the old pathogen code tab. Next slide. CR 1688 is to remove specific genus and species from being reported to in a BSI event. The list is displayed on the slide. This includes the LCBI, which is laboratory confirmed bloodstream infection, and the MBI, which is mucosal barrier infection. The screenshot shows the arrows pointing to the two columns. An X means that the pathogen may be reported for LCBI or MBI in a bloodstream infection event. Next slide. CR 1785 is to update the common commensal pathogens. 131 pathogens were added to the common commensal list, and one pathogen was removed. It also only affects the BSI event. Next slide. CR 1816 is a catch-all for pathogen changes. It includes the addition of rhinovirus. It was originally local code, then we removed it from the list, and now we have added it back using a SNOMED code. Extended spectrum beta-lactamase, ESBL, pathogens have been added. A few minor corrections made. The events that are affected are the ones listed below. Some of the events listed below are not valid CDA import, but we included so you can help your customers with non-CDA events. Next slide. This is CR 1816 continued. By filtering column F on the new code, the pathogen roll-up will be listed. The codes with an asterisk always roll up to save in the application as a pathogen listed without the asterisk. This is useful to display the extended spectrum beta-lactamase pathogens roll up to the primary pathogen without the susceptibility description. The example in the screenshot shows ESBL E. coli rolls up to E. coli even though they have different SNOMED codes. Next slide. Some of the ESBL pathogens are also listed in the MDRO definitions tab. Because the list was getting so long, only the primary NHSN pathogen codes are listed on the MDRO definitions tab. You will need to reference back to the pathogens code tab. In the screenshot, notice the red arrow points to EC on the MDRO definitions tab and on the pathogens code tab. Be sure to include all pathogens that roll up to the primary pathogen, and in this example, include EC*1, which is the ESBL E. coli. Next slide. CR 17, the NHSN vocabularies added some columns on the pathogens tab in her working draft. We thought some of these columns would be helpful, so we kept some of them. Column A contains the NHSN internal sort. It is sorted by the pathogen name, bacteria, fungus, virus, parasite, and prion, and then alphabetically by genus species. The 3 columns were added to provide details pertaining to the patient safety protocol. It includes coag-negative staph, viridans group strep, and Enterobacteriaceae. Column AD is the new SNOMED codes and are to be used for 2018 events. Next slide. CR 1757 is for the airway pressure release ventilation, known as APRV, field to change from conditionally required to optional. This affects the ventilator-associated event, which is currently manual entry only, but CDA is coming in 2019. Also affects the ICU Other Summary and the SCA Summary. Next slide. CR 1808 applies to gender validation. All genders will be valid for SSI procedures, events, locations, and specimen types. An example is a male, female, or other gender will be valid for hysterectomy procedure. Next slide. These are a couple of good-to-know changes. CR 1700 is for the BSI event. 2 new fields are being added to the user interface. Extracorporeal life support present and ventricular access device. The BSI CDA will catch up in 2019. Next slide. Next, we will discuss some CDA-related general updates. Next slide. This slide is CDA import data comparison. The slide display is a display of the percentage of CDA imports versus manual entry or CSV import for procedures. The year-date range was selected to include completed CMS reporting. We plan to run this report 4 times a year based on the completed CMS reporting date, and hopefully we'll see the CDA percentages increase. Notice that Lab ID and dialysis events are the highest at 50 and 49 respectively, and MDRO summary is the lowest at 6%. Next slide. For direct CDA automation update, we are up to 14 vendors and about 5,900 facilities sending via direct. For those of you who do not do direct yet, it is a batch submission process with no immediate reply. Turnaround time is based on volume of messages in the queue. If you are new to direct or want to learn more about direct, there is a direct toolkit on our NHSN website. Before you start your process, we recommend that you schedule a call with us. We will be happy to discuss the process and recommend best practices. A developer and direct administrator join the call for a technical discussion. Next slide. CDA support is available on the NHSN website. The 8.8 toolkit and guide for CDA versions have been updated. We support CDA versions that are valid for the past 2 years. As you can see in red, the table has been updated to include the CDA valid for 2018 data. The links are provided on this slide. After we receive the ICD-10 codes, we will update the website with the final 8.8 IDM. Next slide. The pre-production test site has been moved to a more stable environment. It is also being referred to as the NPPT site or beta site. As you know, it is a copy of the NHSN development environment. It now includes analysis and reporting functionality, so now antimicrobial use and resistance data may be verified. It does not include direct CDA automation or groups. There are no SAMS credentials required. If you would like to have a test facility in the pre-production environment, send an email to our mailbox at NHSN CDA at cdc.gov. Next slide. For those of you who already have a pre-production test site, the NHSN 8.8 environment will soon be available for testing. We will send out an email. As a reminder, at the login, read the important message. The effective date to test 2018 data is March the 1st, 2017 to the current date. Examples of testing. To test 2018 pathogen business rules, a BSI event date must be between March the 1st, 2017 and the current date. The new R3D1.1 dialysis event CDA must use event dates between March the 1st and the current date. The current R3D1 dialysis CDA event must use event dates from January 1st, 2017 through February the 28th, 2017. When January the 1st, 2018 arrives, effective date will be removed. Next slide. Beta testing. Now that the pre-production test site is in a stable environment, NHSN has scheduled a beta testing period for Release 8.8. 60-plus users will be beta testers. They will test manual entry analysis and reporting functionality and provide feedback. The beta test period is approximately October the 23rd through November the 3rd, about 2 weeks long. Next slide. Due to beta users requiring existing data for testing, the system will change for about a month from October the 5th to November the 3rd. The process includes a backup of the NPPT database performed October the 5th. Each night, a database restore will occur using this backup. Added facility locations, monthly plans, and surgeons will need to be re-entered each day. This data will not persist. After the beta test period is over, the current process will return. Added facility locations, monthly plans, surgeons will remain. Only events and summaries will be deleted nightly. As always, your feedback is very important and assists us in improving changes and correcting issues, so thank you. Next slide. Next, we're going to talk about future CDAs. Next slide. As we discussed today, the dialysis numerator and the hemovigilance denominator CDA versions are moving to R3D1.1 version for the January 2018 data. Planned for 2019 is the VAE, Ventilator Associated Event CDA, the Flu Summary CDA, and the updated BSI numerator that will include the two fields we mentioned. Planned for 2020 are the updates to ICU Other, NICU, SCA, MDRO, and dialysis denominators to include Report No Event. The BSI event will include a few more fields. A new component will be added for late onset sepsis meningitis event. It will be electronic only, no manual entry. This will include the event and summary. Next slide. Just a few reminders. As always, we welcome feedback. We offer individual vendor conference calls. Make sure you are on the NHSN CDA email distribution list. To be added, email the NHSN CDA mailbox with your request. Be sure to visit our CSSP site. Next slide. So this ends our 8.8 webinar. We thank you for joining, and we will stop the recording now. Thank you.